Hello and welcome to my presentation on electronic health records. Today we're going to talk about electronic health records. We're going to establish what exactly are electronic health records and when did they come about. Who uses electronic health records or EHRs and for what purpose do they use it? Some of the HIPAA concerns and patient privacy concerns with EHRs, the technical capabilities of EHRs which includes data limitations, the pros and cons of EHRs versus traditional paper records, and then finally we're going to analyze 3 EHR examples: Epic Care Ambulatory, Allscripts TouchWorks, and Praxis EHR. What are electronic health records? Well, Emmenworth and Horps describes the concept of a comprehensive, cross-institutional, and longitudinal collection of a patient's health and healthcare data. Essentially, what this says is that it's an electronic form of documentation that can be widely communicated across a multitude of medical specialties, specifically related to patients' health and healthcare data. The timeline on when electronic health records has been established I found to be somewhat conflicting. According to Emmenworth and Horps, they suggested that electronic health records were established in the 1990s, specifically stating that since the dawn of the concept of an interorganizational, comprehensive, patient-centered health record in the 1990s in the US, the different concepts of such a record, for example, computer-based patient record or continuity of care, were always driven by the idea to support healthcare and to maintain, respectively, improve its quality. But the issue I found is that, according to Shortlift, by the late 1960s, there were experiments with full-fledged electronic medical record systems that collected data directly from clinicians and were designed for use in both inpatient and outpatient settings. And I think the conflict arises out of the interpretation of what an EHR is and how it's being used today. I think realistically, in the 1960s, they probably were using electronic medical records, or at least some form of electronic documentation system to collect data from patient encounters. However, in the 1990s, with the evolution of technology and the use of personal computers, it probably became more widespread and more widely available to medical practitioners. One of the interesting things I found was this study by Furukawa et al. And essentially what the study said was that there is a correlation between the passage of HITECH, or the Health Information Technology for Economic and Clinical Health Act of 2009, and the aggressive growth of EHR use from the years 2008 to 2012. And I think that what the study was saying is that CMS, as a government agency, incentivized the adoption of EHRs. And so by incentivizing the EHR system, it really encouraged both small and large medical practitioners to adopt EHR use within their facilities and have some type of benefit towards making that leap in their documentation practices. This is a flowchart just illustrating how information passes through an EHR network from medical specialties on the far left to the primary care physician on the right. And I think at the end of the day, what this states is that the primary care physician has access to all of the documentation of patient encounters for medical specialties, and because of that access is able to better coordinate the care of the patient and divert them to the appropriate medical authority through treatment and diagnosis. Some of the examples of who would use EHRs are listed here. It's going to include your private practice medical offices, clinical and outpatient laboratories, pre-hospital emergency response, so your ambulance service providers, medical specialty practices, pharmacies, durable medical equipment companies, and major hospital systems. HIPAA and EHR, there really is no true difference in traditional paper records and EHRs as far as the demand for patient privacy. Where there is a slight difference is in how you protect that patient privacy. So a lot of the concerns with EHRs is access to patient information or sensitive information. But a lot of EHR companies have put security measures in place to validate sign-in and patient record access. And what I mean by that is that individual user profiles can be set up so a medical provider can see who's been accessing patient information and whether that individual had a real need to know or a need to access that information. There's also public concern for data breaches with the recent emergence of financial institutions and credit reporting agencies going through large data vulnerability breaches. Health information providers is really no different. It's a large source of data storage for personally identifiable information and can be vulnerable if uh, security, the IT security is not put in place or safety measures. At the end of the day, EHRs are computer-based software applications. They, of course, require the internet-capable devices and networks, and that's mostly for communication purposes, for interfacility communication. There needs to be some type of data storage capability, and that can either be an on-site server that can be established, which can be pretty expensive, or more commonly used today, a cloud-based subscription that's provided by the EHR provider. They, of course, require data security monitoring and safeguards to be put in place to make sure that that information is kept secure. Next, we're going to be talking about some of the EHR pros and cons versus traditional paper records. Some of the pros for EHRs over paper records is that it establishes a time saver for providers. With the use of AI and data predictive analytics, they can really medical providers can save time on documentation because the EHR is able to learn preferences and take data and digest it across multiple encounters. It also saves time by allowing a a wider availability of access for medical specialties that may be geographically separated. It also is a money saver. It allows the EHR system can identify vulnerabilities or gaps in revenue where a medical provider would be able to make those processes more efficient. Also can be environmentally friendly because you're not using as much paper with an EHR system. And of course, it keeps medical practitioners better organized in their documentation practices. And probably the largest benefit is the patient engagement benefit, where patients are able to access their information through patient portals. Of course, cons, we discussed some of them, the data security concerns and the privacy concerns that can arise from the use of EHRs, and also the lacking of software updates or vendor changes. And what I mean by that is if a vendor goes out of business, either from lawsuit or a failing business model, it's hard then for a medical practitioner to just uproot their entire documentation system and switch to another. The first of the EHRs that we're going to be talking about is Epicare Ambulatory. And really, this offers a unique patient engagement through a very specific web-based portal. It gives patients the ability to access their information from home. It has a robust AI capability, which uses predictive analytics. And what that does is it reads and digests information across different encounters and allows the medical provider to make better decisions. Of course, there's a personalization ability, so the provider can meet their own personal preference. And it leverages telehealth capabilities by allowing providers to remotely access information from home or geographically separated areas. Allscripts is similar. There's a patient engagement portal, real-time access to patient data for preventive health, and there's a unique open platform connectivity to other medical users, so other medical practices will be able to access. And there's a capability to e-prescribe, which can be a real benefit to patients who are looking to refill medications. Lastly, there's Praxis. Has a unique 3 possible documentation outcome system, which the EHR will measure whether or not an occurrence through medical terminology is going to be the same, a similar one, or a completely different one, and it will remember that through its AI concept processor. Leads to a reduction in editing and documentation, which can greatly benefit medical practitioners.